Hi, my name is Angela Suarez, and I am performing a head-to-toe assessment for Maryville University. This is Leslie. She has volunteered to be my patient today. Prior to coming in the exam room, I asked her to empty her bladder, and she also changed down into a tank top and shorts. We obtained a height and weight and a full set of vital signs. We also measured her distance vision with the Snellen chart and her near vision with the Rosenbaum chart. And I have washed my hands and we are ready to start. First, I'm going to begin by assessing your head, face, and skull. I'm going to look at your skin and the tone, and it's normal. It's evenly distributed, normal in color. Temperature is good. Okay. I'm going to start by palpating your scalp and your skull. It is normocephalic. I am also feeling the texture of your hair. It is evenly distributed. The hair follicles look normal, no inflammation or areas of alopecia. Okay. And I'm looking at your facial features, your eyes, your nose, your mouth, your ears. It's all symmetrical, even. Okay. And now I'm going to begin by palpating your facial bones. Symmetric. Okay. All right, next I'm going to move on to your sinuses. I want to palpate to see if you have any tenderness. I'm going to do your maxillary and frontal sinuses. Is that tender at all? Any pain? Okay, and there's no swelling. Okay, and I'm also going to feel your temporomandibular joint here. If you can, open your mouth. Okay, and you can close. There's no popping or clicking, any pain with that. Okay. I am also going to move on to test your light sensation. Okay. I want you to close your eyes for me. Can you feel that? Yep. Equal on both sides. Okay. Now I'm also going to test some of your cranial nerves. I'm going to have you smile real big. Okay. Clench your teeth. Okay. Puff out your cheeks. Stick out your tongue. Wrinkle your forehead. And squeeze your eyes real tight. Awesome. Okay, and there's no abnormalities there. I'm going to move on to your eyes, if I can remove these. I'm going to look at first your eyebrows and your eyelashes. The hair is distributed evenly. Your eyelashes extend upward and outward. I'm going to feel around the orbital area. There's no swelling, redness, any tenderness. I'm going to now feel your eyelids, if you can close your eyes. Okay. Go ahead and open. I'm going to look at the sclera and conjunctiva. Okay. Okay, and it's pink, it's moist, your sclera is white. I'm going to palpate the lacrimal apparatus. Is there any tenderness? Okay. Now I'm going to assess your pupil response. Okay. I'm going to have you stare at a point on the wall for me and just look forward. I am looking for direct and indirect response. I want it to be equal and reactive to light. Okay. And now while staring at that same spot, I want you to cover your right eye. Okay. And now cover your left eye. Okay. And there's no twitching or extraocular movements, no nystagmus. Okay. I'm also going to do your extraocular movements with the 6 cardinal fields of gaze, okay? So I want you to follow the pen light. Don't move your head, just follow with your eyes. Now, I want you to cover your right eye. And I'm going to cover my left eye, okay? And I want you to tell me when you see my fingers. Okay? Okay. 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 Now the other eye. Okay. 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 All right. Now we are going to move on to your ears. I want to first, inspect it first, okay? I'm going to look at the symmetry of it, the alignment with your eyes, okay? And the skin color is normal, conforms with the rest of the skin around your face and neck. And palpate the auricles. No nodules, no tenderness, okay? And I'm going to look at your tympanic membranes in your ear canals. Okay. I'm going to pull up and back on the auricle. Ear canal, there's no inflammation or redness. Tympanic membranes are gray and pearly. No redness, swelling, or any fluid. Now I'm going to go behind you and I need you to cover one ear and I'm going to whisper a word and I want you to repeat it for me, okay? Apple. Okay. Cover the other ear. Orange. Okay. And next I'm going to check the Weber test. And this is for unilateral hearing loss, okay? I'm going to place it right here on the top of your head. And I want you to tell me if you hear it in your left ear better, your right ear, or equally. Okay? Okay. I'm now going to assess for your bone and air conduction with the Rhine test. I want you to let me know when you no longer hear it, okay? Okay, and the air conduction was 2 times greater than the bone conduction, so that is normal. Okay. Next, I'm going to move on to your nose. You can put them back on. I'm going to look at the skin color, which is normal. There's no discolorations. Your nose conforms to the shape of your face. Okay. I'm going to look up your nares, if you can tilt your head back. The nares are oval, symmetric, turbinates, and the mucosa are pink. There's no inflammation, swelling, or drainage. Okay. The septum is midline. There's no deviation. Okay. Next, we are going to look in your mouth. I'm going to start by looking at your lips. They're pink, moist. There's no cracks or fissures in the corner. I'm going to look at the buccal mucosa. I'm going to look at your gums and your teeth. It's pink and moist. Teeth are white. She's got good dentition. There's no bleeding of the gums. Okay, I'm going to have you stick your tongue out. Okay, it's smooth. I'm going to look at the lateral borders. There's no nodules, no discolorations. Okay. Now I'm going to have you stick your tongue out, move it side to side. I want to check the movement. Okay, and lift it up. I'm going to look at the floor of your mouth, look for any signs of oral cancer. Okay. And now I'm going to look at the back of your throat. I want to look at your pharynx, the tonsils, the pillars, and the uvula. If you can, open up and say ah. Okay. And the uvula rises along with the soft palate. See the hard palate. And I'm now going to test your gag reflex. Okay. Okay. Right. And now moving on to your neck. I'm going to look at the skin color, and the neck is smooth. There's no jugular vein distension. Okay. I'm I'm going to palpate the carotid on each side, one at a time. With the rate, rhythm, intensity. And I'm going to palpate your lymph nodes. I'm going to go with the preauricle. Tonsillar, occipital, submental, submandibular, superficial cervical chain, posterior cervical, deep cervical, suprapendicular. Okay. And they're all normal. There's no swelling, masses that I feel. Any of that tender? Okay. Okay, I now want to palpate the trachea, and it is midline, and the thyroid. I'm going to have you swallow. Okay, and that moves upward with swallowing. I'm now going to auscultate your carotids. The rate, rhythm, intensity. Listening for any clues. Okay. I want to test some range of motion with your neck. If I can have you lean your head to one side and then to the other. Forward, backward. Just turn side to side. Okay. And now I want you to do that with me in resistance. Okay. And shrug your shoulders for me. Okay. All right. And next we will move on to your upper extremities. I'm going to take a look at your arms, the skin, the tone, the muscle mass. I want to look at temperature. I want to look at hair distribution, which is even. Okay. I'm going to move on to your hands. I'm going to look at your nails and your nail beds. There's no clubbing, no signs of sinuses. I'm going to do a cap refill. It's brisk, less than 3 seconds. Okay. Okay. I want to check your pulses. Check your nail pulse. Okay. And your breathing. Okay. I'm also going to check your reflexes. And I would do that on both sides. Okay. And now I'm going to move on to your posterior chest. If I can, I'm going to have you switch to that side of the bed with your back facing me. Okay. I'm going to just take a look at your skin color, which is normal. It's evenly toned. I'm watching your respirations. They're even, unlabored. Symmetric. There's no use of accessory muscles. I'm going to palpate for any tenderness. Okay. All right, and I'm going to ask you to repeat 99, and I'm going to assess for tactile fremitus. Okay?
99.
Okay.
99. 99.
Okay. And I'm now going to percuss in a systematic fashion. I'm looking for resonance. Okay. And I want to look for the costal configuration. If you can take a deep breath and out, I want to ensure that it's rising symmetrically, which it is. Okay. And now I'm also going to assess for your diaphragmic excursion. So I'm going to lift this up briefly, and I would do this on each side. Take a deep breath for me. Okay, and out. Okay, and now take a couple breaths, and then I want you to hold your breath, let it out, and hold it. I would then measure the difference, and a normal finding would be 3 to 5 centimeter difference. Okay. Okay. I now want to percuss your lateral side also for resonance. Okay. Okay. I'm going to ask you to go ahead and turn back around. Okay. And again, I'm going to assess your skin tone, even distribution, your respirations, even unlabored, symmetric rise and fall. I am going to assess your precordium and palpate. No tenderness, no mass is noted. I'm going to feel for your apical pulse. Okay. I'm also going to percuss the anterior chest. Okay. I am going to assess your tactile fremitus in the front, make sure you're not having any. So go ahead and repeat 99.
99. 99. 99.
Okay, and there's no accents or changes in the tone. I'm now going to listen to your heart sounds. I'm listening to the aortic valve, pulmonic valve, Erb's point, tricuspid, and mitral. I'm also going to listen to your lung sounds and just breathe normal. To assess clavicular nodes, and if you can raise your arm, I'm going to feel for your axillary nodes. Okay, I'm going to listen. Okay. And while you're on this side, I want to palpate for your clavicular border. Listen to your lung sounds. Take a deep breath for me. I'm going to ask you to go ahead and lie on your left side. And I'm going to also listen to your heart. Okay. Okay. And go ahead and lay on your back. I'm going to begin the inspection of your abdomen. I'm going to use the light to look at the contour, the skin tone. Okay. Any characteristic changes? There's no pulsations or bulging. I'm then going to listen to your bowel sounds in all 4 quadrants. I would listen to up to 2 minutes in each quadrant. If I didn't hear anything, I would listen to up to 5. Okay. I'm going to note the frequency and characteristics. And listen to the aorta artery on both sides, the renal, iliac, and femoral. Okay, there's no bruise or thrills. I'm going to percuss the area of the spleen. You're going to hear tympany over the air-filled areas and dullness over the organs. I'm sorry, that was your liver. I'm percussing your spleen on this side. Okay. I'm now going to palpate for the border of your liver. Go ahead and take a deep breath. And also your spleen. Take another deep breath. And that would be normal not to feel that. I'm now going to palpate for her left kidney. And her right kidney. And I'll just do some deep palpation of the abdomen. Any pain or tenderness? And I'm going to feel the aorta. There's no pains or thrills. Okay. I'm going to ask you to just lift your head a little bit. There we go. We can palpate the abdominal muscles. Okay. Go ahead and lay flat. I'm going to begin to assess your lower extremities. I'm going to look at the skin color and tone, the temperature, just the hair distribution, which is even, temperature is warm. I'm going to assess your muscle mass and tone. Okay. And then we'll move on to assess the pedal pulses. The dorsalis pedis. Also the popliteal. Dorsalis pedis. Posterior tibial. The popliteal. I'm going to note the rate and rhythm and intensity. There's no edema or swelling noted. I now am going to assess your strength, so push against my hands, okay? And push up against my hands, push down, okay? You can now go ahead and sit up for me. I'm going to have you dangle your legs off of the bed. Okay. I'm going to test your reflexes, test your knee, and your Achilles. And I would do that on both sides. And I'm going to ask you to stand for me. And I'm going to, stand just like that, assess your spine. It's all midline, no tenderness. I'm going to have you bend and touch your toes. There's no signs of scoliosis or kyphosis. Okay, go ahead and stand. And you can have a seat. And that concludes my head to toe health assessment.